Hair loss affects roughly half of all women at some point in their lives. It can be triggered by hormones, by stress, by childbirth, by the natural process of aging, by medication, by nutritional deficiencies, and often by several of those things at once. And it shapes how a woman feels when she looks in the mirror, and how she shows up at work, and how she moves through the world. And yet most women who experience it believe, well, at least at first, that they are the only one. And the beauty industry has never quite known what to do with this, because female hair loss doesn't fit neatly into a product category. It doesn't respond to a single hero ingredient, and it can't be solved by switching your shampoo. So the beauty industry has largely left women to piece together their own understanding from whispered conversations and late-night internet searches, while selling them the products that promise far more than they can deliver. So today's guest has built her entire career around filling that gap with clinical expertise and rigorous assessment, and an ethical philosophy that sometimes works against her own commercial interests. And she's going to make you think differently about what it means to treat hair loss well, and what green beauty actually looks like when there's no product involved. Settle in for a fascinating episode. Welcome to Green Beauty Conversations, in which I challenge the beauty industry to become sustainable, champion independent and green beauty, and encourage you to join me in making beauty better. I'm your host, Lorraine Dallmeier. I'm a chartered environmentalist, biologist, and the CEO of award-winning online organic cosmetic formulation school, Formula Botanica. We have tens of thousands of students in over 190 countries around the world who study with us to become organic beauty formulators and entrepreneurs. Visit our website at formulabotanica.com to try our free online formulation course. And if you want to be the first person to know what's happening in green beauty, make sure you subscribe to this podcast in your favorite podcast app. So in today's episode, I'm joined by Chloe Heyworth, a UK-based trichologist and the founder of Micro Artistry, a specialist clinic dedicated exclusively to scalp health and non-surgical hair restoration. With expertise in scalp micropigmentation, which you're going to hear all about in this interview, and clinical hair loss assessment, Chloe's work sits at the intersection of science and artistry and ethics. A multi-award-winning practitioner, Chloe is actively involved with the British Association of Hair Restoration Surgery, working alongside surgeons and medical professionals to promote a more medically aligned approach to hair restoration. She's particularly passionate about raising standards within the non-surgical hair industry, advocating for evidence-led practice and greater transparency for clients, many of whom are women navigating hair loss. Hi, Chloe. How are you doing today?
I'm really good, thank you. Thank you for having me. How are you?
I'm good, and I'm really looking forward to finding out all about what you do. So let's start there. Could you please introduce yourself for our listeners?
Yes, so I am Chloe Heyworth, owner of Micro Artistry Hair Clinic in the southwest of England. I'm primarily a scalp micropigmentation artist, but I'm also a trichologist, and I specialise in various hair restoration treatments, treating people with hair loss.
Amazing. Well, for anyone listening who doesn't know what a trichologist is, shall we start to unpick it a little bit there? First of all, what is a trichologist?
So a trichologist, I do make my life hard for myself because no one's ever heard of any of the treatments that I offer. But a trichologist is someone who specialises in conditions of the hair and scalp, and we're specialised in identifying different scalp disorders, different hair loss conditions. So although we're not medically trained, we are highly trained in identifying the different conditions. So we can work with dermatologists and GPs as far as referrals, but a lot of things we can treat in clinic.
Okay. And so who do you typically work with in your clinic?
With the trichology, I see all sorts of different people, all different age ranges, men and women. I think it's a misconception that women have hair loss less frequently than men, or it's less common, but actually it's just as common. So it's really 50-50, and I feel really lucky to have that where I do see a mixture.
Yeah, I understand that. And I think probably a lot of people aren't aware of how common female hair loss is. Can you tell me a little bit about that?
Yeah, so female hair loss is almost as common as male hair loss, but because it tends to shed in a different pattern to men, it tends to be not as visible. And there tends to be a lot more reasons why women lose their hair. For example, androgenetic alopecia, that's the pattern hair loss. that we see and probably most commonly know with men, where in men it recedes in the hairline, they get thinning on the temple area, whereas with women it falls out in a different pattern. It's a widening of the parting. So it's not as visible. And I think that's why people assume it doesn't happen to women as often. And then you have the added complications of hormonal changes in women. So this can happen with underlying conditions such as like polycystic ovaries or a thyroid dysfunction. And then after pregnancy as well, of course, it's very common to see changes in your hair. And then we have menopause as well. So we have all different stages throughout our life where I think it can be a bit more complex than what men experience with their hair loss.
The joys of being a woman.
We know, we get all the fun.
I know, we have all the fun, don't
Yeah.
we? So imagine someone comes to the clinic. Let's say a woman comes to the clinic. What's the first thing that you do to work with someone who's experiencing female hair loss?
As a trichologist, I ask a lot of questions. I act as a bit of an investigator or a detective to uncover every aspect of their life, whether that's their current lifestyle, stress levels, how they're sleeping, their medical history, family history, what's their diet like, what's their exercise like, hair care. So I really ask such a broad range of questions, and I'm just trying to paint a picture of exactly what's going on in their life and try and work out maybe if they've missed something, or try and piece things together to see if there's a combination cause of why maybe their hair loss is happening. So yes, lots of questioning in my consultations.
And then after that, what are the next steps?
So next steps, if it's something that I can treat within clinic, then I'll give advice or I'll offer treatments that I offer myself to help them. But if it's something that I can't resolve purely by myself, or if it's something a bit more complex, then from there I'm able to refer them to their GP, and we could do blood tests and see if there's any deficiencies going on, because that can play a big role in hair loss and the condition of the hair, and also pick up if there's anything underlying going on. And then if I'm worried that it's something a bit more of a complex type hair loss, such as a scarring alopecia, then I can refer to a dermatologist. So there's lots of options, but majority of the time there are things that I can advise them to do themselves at home, or something that I can help them with in clinic, or it's just a simple GP referral. It's quite rare that it's more complex where I'm needing to involve a dermatologist.
Yeah. And one of the things you use in the clinic, which is also what we're going to talk about mainly on the podcast today, is something called scalp micropigmentation. First of all, can you tell me what it is?
Yes, so another one that no one's ever heard of.
Yeah.
Most people would have heard of permanent makeup or cosmetic tattooing. So it falls under the same umbrella. So whereas with eyebrows, you're creating a hair stroke, on the eyebrow, we're doing something similar in the scalp, but it's using a pointillism technique. So it creates dots on the scalp, and what it's doing is replacing missing hair follicles. So it works best with people who have permanent hair loss and there's no chance of that hair growth coming back naturally. And what we can do is go in and mimic hair follicles on the scalp. So it's very clever, very fine work, and you have to have quite an artistic, I believe, to pull it off successfully, to make it look authentic and real.
I can imagine. Tell me a little bit more about that artistry, because there are so many hairs and follicles on the scalp. So presumably we're talking about a lot of dots here.
I get asked that question a lot. People say, have you ever counted how many dots you've done? I'm thinking, no. But even if I start, I do about 50 within a couple of seconds. So no, it's our heads. We can have hundreds of thousands of hairs on our head. So over the course of a treatment for someone, probably do tens of thousands of dots I know, depending on the extent of their hair loss. So my sessions they can last up to 3 or 4 hours. So it's a long time. It is a long time. And if you think each impression I'm doing is mimicking one hair follicle. So it's very, very painstaking work, really.
That's fascinating. Does it hurt? I'm sure there are lots of people asking themselves that question now.
People always ask that. And most of the responses I get is that it doesn't hurt. So it's not the same as a traditional tattoo. It's very quick in and out of the skin. I'm using extremely fine needles, and it's probably not going quite as deep as a traditional tattoo. So it's a lot less invasive than a normal body art tattoo, where they're using quite large needles and they're dragging under the skin and shading. So it's a very different technique. So it is a tattoo, but because it's such a different technique, lots of people say it's quite therapeutic, and I even have clients who fall asleep on me. So you don't have to use numbing cream or any kind of pain medication unless someone chose to have like a little slight pain relief before, like a paracetamol or something. So yeah, it's very, very minor and even quite relaxing in some areas of the scalp. So I'm being told.
And how permanent is it? Because obviously if you have a normal sort of ink tattoo put on your body, it's there for life, really. I suppose it fades a bit over time, but what's it like with the scalp micropigmentation then?
Technically, it's permanent because it is a tattoo and it's using very similar pigments to what you'd use in a tattoo treatment. But because the pigment is diluted with water, you've kind of you sped up that fading process prematurely. So the pigments are going in already diluted in the skin. So your body's able to break it down easier than if you're putting just pure pigment into the skin. The molecules are smaller so that the body can start breaking that down easier. So it does fade gradually over many years. It probably, once it's in the skin, it probably would be visible, for decades really. But over those decades, it would lighten over time to a point where it may become not visible. And then that's where you'd want to look at having a top-up session or a redarkening session. But it lasts for a very long time. So once you've had that initial treatment, it's very low maintenance, which is one of the benefits to the treatment.
Yeah. There are a lot of formulators who listen to this podcast, and they're probably thinking to themselves, which is what I thought initially when I first heard about the work that you did, is they do a lot of work in terms of color matching when it comes to color cosmetics and making makeup. And it's always really hard to get the right shades and to make sure it works properly with the skin. So that was my first thought, is how on earth do you do the color matching to get someone's hair color right in terms of the ink that you're using? How does that work?
I think people assume that I use lots of different colors, whereas actually the most common one used in scalp micropigmentation is a carbon black pigment, and that's diluted depending on the client's hair tone. So it's diluted so that it heals to varying shades of grey. When it comes to hair, when the hair is shaved down, unless someone has very warm hair, if they're naturally a redhead or auburn hair, the hair is usually a grey tone. So stubble is nearly always has a grey undertone to it. So it's the safest one to work with, because I find once it heals to that coolish undertone in the skin of grey, it actually blends with nearly all hair colours, unless a person has a particularly warm hair colour. There has been the introduction of brown pigments into the industry, but I am hesitant to try them just because there hasn't been much long-term results of what those pigments look healed in the scalp. I would be concerned about them possibly turning like a pinky colour or a reddy colour over time, as they can sometimes when they're used in an eyebrow treatment. So I'm avoiding them. I haven't really felt the need to ever use a brown pigment to this point. And the carbon black has been used for as long as scalp micropigmentation has been around, which has been over 15 years now, maybe even 20 years. So you have very good examples of long-term healed results, and you can see even 10 years, it hasn't discolored as long as you've chosen the correct color for that client and you've diluted it correctly. It's just the safest and it blends the best, I find.
It's really clever. I suppose another question I have is, imagine that you're experiencing a degree of hair loss and you go in and you have scalp micropigmentation done. Then you continue to lose hair. Is there then a risk of the sort of tattoo on the scalp becoming more visible, or the effect not being quite as great? But talk me through that.
Yeah, this is such an important topic, actually, because it's becoming more and more popular with density treatments. So the SMP originally was used for bald men who chose to shave their head and they wanted to restore their hairline and create the appearance of a full head of closely shaved hair, so stubble. But in more recent years, probably the last 5 to 10 years, it's being used a lot more frequently in density treatments where both men and women are losing their hair, but they want to keep their hair long. And it was actually from this that led me into doing the trichology, because I was having men and women come to me wanting to keep their hair long and wanting to have this treatment done. And I was worried about what kind of hair loss was I looking at. I just didn't have the knowledge. As a SMP artist, you really have to try and predict the future and try and work out where that hair loss is going to go 5-10 years from now, to ensure that your work is still going to look good in years to come, and you're not going to leave them in a horrible situation where, you know, they have this visible treatment on their scalp and then they're in a worse position than maybe when they started. So I think it's very important for SMP artists to have more in-depth knowledge of different hair loss conditions, because you do need to be able to predict what that hair loss is going to look like in many years to come. So you're right in thinking that you need to have enough hair to start with in order to blend the SMP treatment naturally within the long hair, so that it's not visible in the daylight or in bright lighting. And if someone has thin hair but they want to keep their hair long, they do have to look at what other things can they do to maintain the hair that they already have, so that it will look natural for many years and their hair loss isn't going to worsen and continue.
Interesting. Just for anyone listening, SMP means scalp micropigmentation.
Yes.
You mentioned something about keeping your hair long. What does the length have to do with it?
Well, so if someone just chooses to shave their head, there's no risk of, if they continued losing their hair, you can just go in and fill in the gaps of where the hair loss has continued to go, because it's the tattoo and it's permanent. It is going to be very visible on the scalp. So if someone had a widening of the parting and they wanted to fill in the gaps and create the illusion of more hair density and cover the exposed areas of scalp, you have to have enough hair there to naturally blend in the impressions that you're creating with the tattoo with the rest of the hair follicles. Otherwise, you're going to have this 2D effect of the tattoo against the 3D effect of the hair. So you'll be able to see the shape of the head and the scalp underneath if there's not enough hair there to work in and create some deflection of the light reflecting.
Yeah. No, that makes sense. And so then where does scalp micropigmentation typically sit in the line of treatments? Because I'm guessing it's probably not the first thing that you recommend to someone when they come to you, because you now take a more holistic viewpoint. So what are someone's options? Imagine someone comes to you and says, I'm a woman, I'm noticing hair thinning. What options does she have before you even get to scalp micropigmentation?
Yeah, you're absolutely right. I always advise to use scalp micropigmentation as a last resort once you've explored all other options, or use it as a combination treatment with other therapies that are going to help maintain or even regrow their hair naturally. So if they come into me and they're at quite early stage of hair loss, or even to moderate stage hair loss, there's lots of things that can be done. For example, at home, minoxidil is very popular to use, and this can help extend the growth cycle of the hair and help to maintain hair follicles that are in that miniaturization phase, which is what happens during a pattern hair loss. So the hair follicle shrinks gradually over time. So that's a good place to start. As well as that, either instead of or alongside, you can use low-level laser therapy. This is something that I really like. It's natural. You're not using products, nothing that's going to potentially irritate the skin, which can happen sometimes with minoxidil. And it uses a laser using infrared and near infrared lights to stimulate the cellular activity of the hair follicle. So I always think of it as like sunlight on a flower, and our hair's the flower and the laser's acting as the sunlight. So it stimulates blood flow and circulation. That's another really lovely one. And then in clinic treatments, so we have a sort of a fairly new one that we've introduced to the clinic, and it uses a combination of microneedling the scalp and using serums that are derived from stem cells to help stimulate the growth of the hair follicle. It's really clever, and also it's treating the condition of the skin on the scalp, which I think is quite often overlooked. So you need to have a healthy environment for the hair follicles to grow healthily and to their full potential. So this is treating two things in one. And then another treatment, which is slightly more invasive, is that we have the platelet-rich plasma. So this is a treatment that uses your body's own platelets. And again, it's injected into the scalp. So a bit more invasive, whereas the microneedling is just making micro punctures in the surface of the skin. This is actually injected under the skin. And this also helps to rejuvenate miniaturizing hair follicles and has been shown to be really effective in many different types of hair loss conditions. So there's lots of things that can be done and should be done before you reach a point of using scalp micropigmentation as a hair loss solution, particularly for women or people who want to keep their hair long.
Yeah, that makes sense. I suppose, again, thinking of the formulators listening, there are so many products now being thrown around on the internet. And I went through a phase last year where I was seeing a lot more hair in my hairbrush. And it was part of the reason I actually cut my hair off, because it was so long and I kept getting tangled up in it. I thought, if it's shorter, maybe I won't be taking so much hair out. And actually, lo and behold, I'm not. But I got sucked into that TikTok rabbit hole, and all the rosemary oil, the rice water sprays, all those. I mean, does any of that work?
It's such a minefield out there, because I'm searching for all these different things on behalf of my clients. My algorithm assumes that I'm experiencing hair loss. So I'll be seeing all the same adverts and kind of hacks and things that my clients will be seeing. And it's so overwhelming and so confusing. I would say don't get too drawn in, particularly by things like the hair oiling. I think this has gained a lot of popularity.
It has.
Over the years, hasn't it? It's not to say there's nothing bad with the hair oiling. It's not going to worsen your hair in any way. But I think a lot of it's quite misleading marketing. So the ones that you were speaking about, the pumpkin seed oil, rosemary oil, those are the ones that you probably hear of quite often, don't you?
Yeah. Batana oil.
Yes, yeah. All of them, when you look at kind of the reason why those are the ones that picked out amongst all the others is that they stimulate blood flow and they're increasing circulation. So they work in a similar way to something like minoxidil, but just at a much more diluted level. But that's why those are the ones that get picked out and I guess put on a bit of a pedestal, that those are the ones that work. But I think people don't realise is that it's not so much the oil itself that might be stimulating hair growth or improving the quality of your hair growth. It's the process of massaging those oils into your scalp. Yeah. So again, you're boosting circulation, giving your hair nutrients, a new blood supply, new oxygen supply. So actually, if anyone's using oiling, I would actually say just do the massaging, because the massaging part is the most beneficial part that they're probably seeing. If they're seeing results, it's probably from the massage. You can massage in your own natural oils. You don't have to buy oils. You can just use your body's own natural oils.
No, it's interesting. I mean, I suppose it also smells nice and it can make your hair feel soft. And I've done a fair bit of it too. So I get it. But that's interesting. An interesting perspective. What does bad scalp micropigmentation look like? Dare I ask?
Unfortunately, there's lots of examples of bad work out there. So the way it can work, the way it can look, the impressions can be too big. So you obviously don't want the impressions to look like dots on the scalp, but this is where it can sometimes happen. And the reason for that is the artist has used either needles that are too large and the impressions are too big, or they've placed the pigment too deep in the skin. And what happens is the pigment can migrate underneath the skin and blur. And then it becomes a large kind of blob really of ink, which is definitely not what we want, because we're trying to create hair follicles. We're not creating blobs on the scalp. Other ways that it can go wrong would be if it's an incorrect pigment dilution, if the pigment is too dark and for the skin tone that it's being used on. And that's when sometimes it can heal to a bit of a bluey undertone, which is definitely what you don't want. Again, the bluey hues can come through if the pigment's being placed too deep in the skin. So it's all incorrect technique from the artist when it goes wrong. Also, you can have oversaturation. So, the space between the impressions is just as important as the impressions themselves. So you want to leave gaps between the dots to make it look natural, make it look like stubble. If you're just layering over and over on top of each other, that's when it can start to look a bit inky. And then that's when over time it can migrate and just become one colour or one blur. So spacing is very important. I think that's not really spoken about enough.
Yeah, I can see that. I mean, I'd never even heard of scalp micropigmentation until I'd met you. So I'm not surprised spacing isn't being talked about enough. I'm sure many people have never heard of it. What does practicing ethically look like for you then?
So for me, I think having that more in-depth knowledge is very important. And that's allowed me to offer a much more ethical service overall, because I'm able to identify exactly what's going on and give a combination of treatments that would be most suitable for the client. So it's not a money grab. It's not, people might come in and if they just offer one treatment, they're offering that one thing to everyone. But I think it's really important. You need to offer a variety of services to treat them in the right way. And unfortunately, I think particularly in the scalp micropigmentation industry, there's very limited training over the years. There's been a huge rise in short training courses, just a few days, and then they're allowed to go and treat people with this tattoo. But unregulated industry, the same as Botox and filler. So it's very difficult. Lots of clinics have made, I guess, lots of money through these training courses, but actually we're seeing more of a rise of apprenticeships being introduced as well, which is really positive, and more long-term in-depth training, which is really important. So yeah, I like to think that I do offer a very ethical service because I have such an in-depth knowledge of the hair and scalp, and I offer so many different treatments now that I do truly feel like I give the best advice and best option for that client. Everything's very tailored and very personalised.
Yeah. I mean, we have listeners all over the world. So, I mean, you're talking about it not being regulated in the UK, but presumably this is a treatment that's offered globally, and it's probably not being regulated anywhere, I'm guessing.
Yes, I believe the only place it's regulated, or I believe you have to have prior medical training, is in Japan.
Oh, wow.
Yes, and their training for scalp micropigmentation, again, I believe this is right, but I think it's around 3 years of training. If we could get to that stage, I think that would be fantastic.
If any of our Japanese listeners can reach out and confirm, that would be helpful.
Yeah, I'd love to know.
I don't think we have a huge listener base in Japan, sadly, but I'd love to know as well. I guess I've one big question for you to wrap up this interview, which is, if you could change one thing around the way that the beauty industry addresses female hair loss, what would it be?
Oh, good question. So I would say it's very important to get a correct diagnosis initially. And I would encourage anyone who's in the beauty industry and is experiencing clients who are coming in to see them with hair loss, if they're not able to give them the advice themselves from like a trichology type perspective, to encourage their client to either see their doctor first or to go and see a trichologist first, because the most important thing is to identify why that hair loss is happening. And quite often there's multiple reasons, internal reasons why it's happening. And those need to be addressed first before having treatment, because otherwise the treatment either won't do anything, or it could even be worsening the hair loss because it's been allowed to continue and carry on for longer. So I'll just really encourage people to have a better understanding, better knowledge of the different hair loss conditions. And if they can't, then to direct their client to someone who does, so that they can attain the correct diagnosis first before proceeding with any kind of hair loss treatment that they might be recommending.
Yeah.
And I would say diet's important as well. People don't really discuss the diet side of things enough, and having enough protein in our diet is very important. Mm-hmm. And I do encourage anyone who's experiencing any kind of hair loss to check how much protein they're having in their diet each day, and to try and hit their daily targets, because our hair is essentially made of protein. So our body uses the protein that we're eating as building blocks to create more hair. And because our hair is not essential for survival, our body tends to be, if our body's in any kind of stress at all, or if it's experiencing any kind of illness, our hair tends to be one of the first things to be forgotten, because all the nutrients are being sent to our vital organs and things that we require to stay alive. So we do need a surplus of nutrition in our bodies to stimulate healthy hair growth. So that's very important to look at your diet.
Good advice. So look at it holistically rather than jumping straight onto TikTok to go and watch videos on what products you can buy, which is the advice someone should have given me, although I really should know better. I suppose my final question for you, Chloe, is where can people find out more about you and your clinic?
So my website is microartistry.co.uk. And I also have social media platforms. My Instagram is microartistry_UK. And those are the two main places where I'm most active, and you can find me there. And feel free to ask me any questions.
Thank you so much. And we'll include those links in the show notes, so do go and visit Chloe's website. Thank you so much for joining me on the podcast today. It's been really interesting learning more about what you do.
Thank you so much for having me. It's been such a pleasure.
Thank you. Bye.
Bye.
I would love to hear your thoughts on this episode. Why do you think the beauty industry doesn't talk much about female hair loss? Why does it feel like such a taboo subject? Leave us a comment on our social channels, as both the Formula Botanica team and I love hearing from you. And if you want to hear some more episodes about the topics we discussed today, please do go back and have a look in the podcast archives. Some great examples include episode 207, in which I interviewed Helena Gibson of Unveil Hair Care, who was also trying to remove the stigma of female hair loss with the products that she'd created. Or episode 208, in which I followed on from that interview with Helena to ask whether beauty is actually the beast in the way that this whole industry makes us feel inadequate if we don't meet their supposed standards. There's a wealth of information in our old episodes, and I do encourage you to go back and listen to them. And thank you for joining Chloe and I for this latest episode of Green Beauty Conversations. I really hope you enjoyed it. If you did, please do leave us a 5-star review so that other people can enjoy these conversations too. Make sure you subscribe to the podcast on Apple Podcasts or Spotify or whatever your favorite podcast app is, and stay tuned for the next episode. Follow Formula Botanica at Formula Botanica on Instagram, Facebook, YouTube, TikTok, Pinterest, LinkedIn. We are everywhere. And come and give me a follow at Lorraine Dallmeier on Instagram and LinkedIn. Visit our website at formulabotanica.com and sign up for our free online formulation course today.